Hi, everyone. I want to welcome you to our Davenport Quad Cities People's Condition of the State event. This event today is one of 7 events that Progress Iowa is hosting across the state ahead of the start of our state legislative session. We're here today to speak up for what Iowans need to be taken care of in our communities. We know that the needs of working families in Iowa are being ignored. Access to healthcare is out of reach for too many Iowans. Our education system is lacking in resources that it needs to prepare for the next generation, and working families need quality, good paying jobs in our state. Too often, the needs of Iowans are being ignored by those who are writing legislation. So today, our speakers will share their voices and their concerns for the people of Iowa. Our first speaker today is the Executive Director of Iowa Citizen Action Network and Lower Drug Prices Now, and she is just a phenomenal advocate for the people in Iowa. I'm going to go ahead and turn it over to Sue Dinsdale.
Well, thank you so much, Amy, and thanks for holding this important conversation. You know, we need to stand up to Governor Reynolds and the Republican-led legislature because we all know that Iowa can do better. So today we want to hold them accountable so we can all have a brighter future. Access to healthcare has never been more important. As Iowans, we work hard to make sure our families are taken care of, but our governor is standing in the way of lower costs and our decisions. She's outsourced healthcare to private companies who get to decide whether we live or die based on profit. And she's prevented Iowans from accessing critical healthcare like family planning services and abortion. Iowa Republicans' tax and economic policies and big business approach are not working for everyday Iowans. Running government like a business and touting tax cuts at every turn just makes it harder for us to be healthy, to live, and to get by. Kim Reynolds and the legislative Republicans hurt healthcare jobs and hospitals when they turned the management of Iowa's $6.2 billion Medicaid program over to large out-of-state insurance companies. Medicaid privatization, another corporate get-rich-quick scheme, has not saved money or made people healthier. Women's healthcare is suffering. Iowa hospitals closed 18 labor and delivery departments since 2017, when the state hired national private firms to manage the Medicaid program. As hospitals are dumping labor and delivery services at record speed, our state is becoming a more dangerous place for birthing parents and their babies. And to top it off, privatized Medicaid isn't required to cover transportation costs of getting birthing parents or their babies to hospitals that are equipped to pay for them or care for them. I know a local community that I used to live in, the nearest birthing center is 45 minutes away. Now, most people, that's fine. But if you're in an emergent situation, 45 minutes can mean life or death. And if you don't have access to transportation, what do you do? And then there's the abysmal response to a global pandemic. Rather than working to protect the health of Iowans, Governor Kim Reynolds is cheering rulings that block federal vaccination requirements for healthcare workers, all while saying the vaccine is the best defense against COVID-19, but continually adding that she firmly believes in Iowans' right to make healthcare decisions based on what's best for them and their families. As the leader of the party of local control, she has taken that away from communities, from schools, and from others by blocking the use of masks and other mitigation measures. How does that work? Don't we have the right to seek medical care without having to risk catching COVID-19 from an unvaccinated staff person? Don't we have the right to send our children to school and protect our teachers by allowing local districts to set the guidelines? Don't we have the right to access information about COVID-19 rather than allowing public health to declare it's too burdensome to require hospitals to report the number of people admitted with COVID? Don't we have the right to work in a safe and healthy state? The messaging from the governor continues to prolong the pandemic at the cost of thousands of Iowans' lives and economic upheaval. It's a choice that has provided a wealth of opportunities for COVID-19 to mutate, endangering everyone. By appeasing the misinformed and politically active ranks of the anti-vaxxers and anti-maskers, she is putting every one of us in jeopardy. It has become so bad that Central Iowa hospitals and clinics have taken the unprecedented step of running a full-page ad in the newspaper with a simple message: help. We are overwhelmed and we need your help. Iowa has the resources it needs to get past this virus, but it doesn't have the leadership needed to do what's right. Kim Reynolds and legislative Republicans have controlled all of Iowa government for the past 5 years. They are responsible for every decision. If their policies are working so well, why aren't we hearing about how great we have it? Instead, they peddle rage, grievance, and victimhood to Iowans. Today, I'm asking, are you better off today than you were 5 years ago? Even without the pandemic, cuts to programs for everyday Iowans to provide massive tax cuts to millionaires and big corporations are only making things worse for most of us. We need to call on the governor and the legislature to lead with science and listen to our doctors to create a health system that puts people over policies and profits and lowers the cost to each of us. Thank you.
Yeah, Sue, I think you've hit on so many really important points. We have seen a state legislature that panders to corporations over people. And it's time that we start working for the people of Iowa and not those corporate special interest groups. And, you talked about hospitals. I live in a rural part of the state, and access to specialty services in rural hospitals is really declining. And it isn't also, just whether you are close to a hospital, it's whether or not that hospital accepts your insurance, because that's a big difference maker too, right? I might live within a half an hour of a hospital, but if that hospital doesn't accept my insurance, I have to choose another option, so that I don't have to pay out of pocket for those services. And that's something we need to talk about too, is not just access, but affordability. And what are we doing to make sure that folks have access and affordable health care in the state of Iowa? And we're sitting on this surplus of dollars, right? Our tax dollars that we want to see invested back into services and back into our communities, not just tax breaks for those corporations and for the wealthy and well-to-do. So you hit on some really great points. Thank you,
Well,
Sue.
and I didn't even touch on the racial disparities when it comes to healthcare, because I mean we could take a whole segment to take care of that one. So yeah, it's not good.
Thank you, Sue. Our next speaker, Glenda Guster, is active in many organizations in the Davenport area. And Glenda is going to share with you some of her experiences with education and early childhood education in the Davenport area. So I'm going to turn it over to Glenda.
Thank you so much, Amy. Affordable childcare is a critical component to growing our economy. Parents simply can't join and stay in the workforce without it. That is why so many of us supported the expanded child tax credit aid that came from Biden administration in 2021 and believe we should make it permanent. We need that help, guys. So we need to make that permanent for these parents that can't afford the daycare but want their child properly educated. The expanded child tax credit not only helped parents get back to work and pump more cash into the economy, it supported our kids, reducing hunger and lifting millions of children out of poverty. Investing in our children is a no-brainer. Expanding the child tax credit and giving every kid access to early childhood education ensures the next generation is prepared to do their best. And as a African-American grandmother, aunt, and also my family, on behalf of them, we need that, because we know from history that when we do well in school, when we're educated, those jobs are open for us. So you know what? And it starts early and it starts at home. So we really need to push that our kids get the best education that they can so they'll be self-sustainable. Biden plan to provide free universal early education to children would make preschool available to more than 6 million children, will spur teacher hires across the country. But Governor Reynolds is putting our kids at and their future at risk. She has censored teachers and driven them out of the profession and wants to send more of our tax dollars to private schools, excluding certain children from opportunities by denying their public schools the resources they need. That's a no-no. We don't need that. We need to put money into our public schools just as well. I know a whole lot of, when I look through history of some of the most famous people, they didn't come from private schools. Most of them came from public schools. So we need to support our public schools. Iowans deserve a governor who values our family and does what's right. By standing together and holding her accountable, we can invest in Iowa families and kids, ensuring a great education to all and a workforce that meets the challenge of the 21st century. As Iowans, we believe every child deserves an accurate, honest, quality education, no matter the color of their skin or where they call home. And this in low income, as well as middle class, as well as rich families. All our kids matter. But Governor Reynolds is putting our kids at risk. She has censored teachers, driven the professions and more tax dollars. I said that. By speaking up and calling on our elected officials to fully fund public schools, we can provide every child a quality education to assure they succeed. As Iowans, we care about our neighbors. We know that investing in our schools, roads, and jobs is good for everyone. But Governor Reynolds only cares about giving big corporations even more. Companies are hiking up prices and our wages are stuck. But she keeps giving big businesses with record-breaking profits more tax cut and giveaways, which they use to pad their bottom line, leaving the rest of us behind. We can and must stand up to political corporate greed to rewrite the rules, creating a fair tax system that invests in our communities. And folks, we need to invest more in our children. We need to invest more in our teachers. And the only way we can do this, we got to stand up. I hear all the time, you can't fight the government. Yes, you can. It just takes all of us to work together. Thank you so much.
Thank you, Glenda. You hit on some really important talking points. And I'm going to say this again, our state is sitting on surplus dollars. Those are our tax dollars. And those dollars should be invested back into our communities. And what a fantastic investment, our kids, right? Putting it into early childhood education, starting every single child in Iowa off on equitable ground so that they all have the same advantages, high quality, affordable, accessible early childhood education. We should have universal free preschool. That's a no-brainer, right? Mm-hmm. All of our kids should be starting off on the same foot. And the second piece of that is when our kids are ready to graduate, incentivizing keeping them in Iowa, keeping them in Iowa colleges. And, we want them to go to our regent universities. We want them to stay in state. We want to stop siphoning our talent and our kids out to other states, right? We want to keep them here so that they are growing their families and not just growing their families, but that they're invested, in staying in Iowa and working here and raising families here. So it does start at the bottom. It starts with, investing in early childhood education. So I agree with everything that you said, Glenda. We should be investing in early childhood education, be investing in our kids, and be investing in public schools, and trust our educators to be the ones making the best decisions in the classrooms, rather than a very small minority of really loud folks who aren't teachers who think they might know what's best. Let's trust our educators. They're the ones in the trenches doing the work. Yeah. Yes. So our next speaker, another really active individual in the Quad Cities area, is Susan Lighthauser, and she is going to speak a little bit about the concerns for water quality and the environment in Iowa. Thank you, Susan.
Thank you. Water quality has always been an important issue for the state of Iowa. The IDNR now routinely issue warning for unsafe recreation activity in Iowa lakes and river because of algae bloom. Some of these algae are extremely toxic to humans. When we put any chemical into our water, in our water system, not only does it impact us directly in the state of Iowa, And they also go downstream and affect our neighboring states, as well as the state down in the Gulf of Mexico, the people who live downstream from us. Agriculture and urban runoff, as well as discharge from the wastewater treatment facilities, ends up in the Mississippi River. This created excess nutrients. They are mostly nitrogen and phosphorus. They go downstream and causing algae bloom down there. And when this algae sinks into the bottom, they decompose, they die, and they in the process depleting the water, the oxygen in the water to a point where it can no longer sustain life. The IDNR, the Iowa State University, and the Department of Agriculture and Land Stewardship had determined that 90% of the nitrogen and 2/3 of the phosphorus from Iowa that ended up in the Gulf of Mexico came from agriculture. Governor Reynolds has allocated $100 million of the ARPA funding to address water quality issues. Part of the money is to address excess nutrients. Iowa has a nutrient reduction strategy that was developed jointly by the IDNR, the Iowa Department of Agriculture and Land Stewardship, and Iowa State University. So this strategy is based on sound science. However, participation of this program is by the landowners is voluntary. NOAA in August went down there and measured the size of the dead zone in the Gulf of Mexico. It is over 6,000 square miles, which translate into 4 million acres of aquatic habitat. The fish and the shrimp that are mobile, they swim away from the area, while the other species like the clams, the oyster, just died. And that impacted their fishing and shrimping industry and the oyster industry, so they have a significant economic impact for the area. The size of the Gulf, the average size of the dead zone in the past 5 years is about 5,000 square miles. So whatever we're implementing here up in Iowa, the voluntary program is not working. The dead zone is growing, and we need to do something about it. And we need to either incentivize landowners to participate in the program, or make it a mandatory program. So as to the quality of our drinking water, most of us get our water from our public water utilities. The most recent concern is the presence of forever chemicals in our water. IDNR has tested 59 cities for the presence of these chemicals. The test result for the Quad City has not been uploaded into the database yet. However, the levels of these chemicals exceeding the recommended limit has been detected in some of the cities. I mean, it was west of Des Moines. In West Des Moines, there was one of the deep well has to be shut off because of the high level of these forever chemicals in the water. Some scientists felt that adverse health outcome can result from levels lower than what the current recommended values is. So as scientists uncover the toxicity of the chemicals that we have in the water, we need to be very vigilant about protecting our citizens, establish limit that will protect our citizens, especially our children. But Iowa is not doing that. Here's an example that what we did to relax the US EPA standard. We all know that lead is one of the very toxic chemicals that contaminate our water system. In 2017, the State Hygienic Lab had published that 1 out of 5 infants that are less than 3 years old, born in Iowa, have blood lead level exceeded the CDC limit of 5 micrograms per deciliter. And lead crosses crosses the placenta. And so when mothers drink water that have high amount of lead in it, it's gonna go into the fetus. EPA had estimated that about 25% of the lead exposure of an adult come from drinking water, while 40 to 60% of that is for an infant because of we use to drink tap water to make their formula. The EPA action level for lead is 15 parts per billion, while our limit is 20 parts per billion. So when you turn on your faucet and get a glass of water, chances are you can have up to 20 parts per billion of lead in your water. So that amount of lead is going to go from the pregnant mother into her fetus, into her baby. One of the major, in addition to the lead in the water, one of the major sources of lead comes from the distribution line and the fixtures. Remember, lead-containing solder is still used in the plumbing trades. In June of 2021, last June, Illinois passed legislation to eliminate all lead service lines. For the protection of Iowa children, we need to do that. We need to remove all possible lead contamination. The rate of childhood lead poisoning in the state of Iowa is more than double of what the national average is. So we cannot talk about lead in water without also mentioning lead paint, the problem with lead paint. So we also need to be vigilant about fixing that issue that we have. The detrimental of lead, we all understand the detrimental of lead. They impact development of children, especially children. So we need to take action to prevent that and protect our children. They are our future. Thank you.
Thank you, Susan. I agree with you. I'm the mother of a toddler, and we live in a rural area, and Sue, this probably is you as well. Living in a rural area, our water is well water, and if you live in an older home, it's expensive to have the ability to update your plumbing in your house, and lead exposure is definitely something that we are cognizant of, and even implementing like a reverse osmosis system in your home, that is also expensive. So if we can find ways to help assist families so that they do have drinking water, that they are not exposing themselves or children, especially like you mentioned, young children, infants, pregnant women, to lead in the drinking water. Those are investments that we need to make. And I'm going to give a quick shout out to Cindy Axney. Thank you for passing the infrastructure bill, Cindy Axney, because part of that money will go toward helping with that drinking water infrastructure. So that's federal dollars, but we need to have that same commitment at the state level, and that comes from state legislature and that comes from our governor. So I agree 100% with you, Susan. We need to invest in clean drinking water, and not just drinking water, but to be able to fish and to be able to recreate. Iowa has beautiful lakes and wonderful waterways. Our streams are great for fishing and great for recreation. But if we're afraid to swim in them, it defeats the entire purpose, and that impacts tourism dollars as well. So we want to make sure that we're doing all that we can to, keep Iowa beautiful and keep our waterways clean. Our next speaker is Kay Pence, and Kay is the Vice President for the Alliance for Retired Americans in Iowa. And I'm going to turn it over to you, Kay.
Thank you. Leaders are remembered for the decisions they made in times of crisis. And Governor Kim Reynolds has shown a profound lack of leadership, compassion, or concern with the health and safety of Iowa seniors and essential workers during the COVID-19 pandemic. Governor Reynolds ignored OSHA complaints regarding unsafe working conditions in meatpacking plants and other essential businesses, leading to avoidable community spread of the pandemic and corporate profits above workers' lives. As of Tuesday, over 8,000 Iowans were lost due to COVID-19, 90% of them seniors over the age of 60. The latest variant of the disease is once again straining our healthcare system, impacting the ability to get care when needed. Governor Reynolds sends mixed messages, suggesting Iowans get vaccinated, then joining the lawsuit against the Biden administration over OSHA workplace safety rules. Rather than coddling anti-vaxxers, Iowans must stand up for essential workers who deserve to be safe at work. Granting unemployment benefits for workers fired for refusal to comply with their employer vaccination rules is a huge departure from typical unemployment policies when employees flaunt workplace safety issues. Imagine similar protections for violators of Iowa's Drug-Free Workplace Act. Reynolds says she trusts people to do the right thing, yet blocks local control of elected school boards trying to keep students and staff safe. Safe workplaces, OSHA regulations, and basic science should not be political. Since OSHA was signed into law by President Nixon in 1970, the number of workers dying on the job have been reduced by 66%. How many lives have been needlessly lost due to the COVID's political fight? The Iowa Alliance for Retired Americans witnessed the isolation, fear, and death of our fellow seniors over the course of this pandemic. Seniors confined to nursing facilities were unable to safely see their families, and many spent their final days alone. Many of our friends have left the workforce earlier than they had intended because it wasn't worth the risks or they needed to be home to care for family members. If we want to entice seniors back into the workforce, we need to assure them that it's safe. If we want to beat this pandemic, we need to put science ahead of politics. Thank you.
Thank you, Kay. And you and both Sue, I think, hit on one of the same issues. You know, we have elected individuals at school boards. We have elected individuals in city council, you know, county roles. And our state legislature worked to take away that local control from those elected officials. And, you know, we elect those folks because they are here, they are on the ground, and they are the best eyes and ears that we have in our communities to make those best decisions. And so, you know, that government overreach absolutely must stop. We need to trust our local electeds. We need to trust business owners to make those decisions about vaccinations in the workplace. If they put a mandate in place for their employees to be vaccinated, we trust that they are making the best decisions for those individuals. And you're right, Kay, about those mixed messages. If you're doing a photo op of showing yourself getting vaccinated, but then filing a lawsuit against vaccines in the workplace, you know, it really does send a mixed message to folks. So I agree with you. These are all of our speakers today: Sue Dinsdale, Kay Pence, Susan Lighthauser, and Glenda Guster. And I'm not sure if we have any press on the call. If we do have press on the call, now would be the time that I would open it up to questions from those individuals. Okay. So I will also take this opportunity if we have any of our guests or staff who have questions for our speakers today. I'm a former teacher, so I have really good wait time when it comes to asking questions.
I was going to mention to Kay, when you talked about seniors in the workforce and all of this with education, my husband is a retired teacher and he's substitute taught for years. And he has made the decision this year not to substitute. And we know that schools are desperately needing them, but because there is no mandate, because our governor took that away, away from our school districts, he said he just can't do it. He cannot risk the health. I mean, we have my daughter's baby living with us, and my daughter, and he's a senior, and me, and we just can't risk that health. Thanks, Governor Reynolds.
Yeah. Yeah, I know 2 substitute teachers that are not teaching this year for the very reason.
Yep. And he was getting, I mean, some days there would be 30 jobs on his sub-call list. And we finally just had to write into HR and say, you know, sorry, can't do it this year.
Yeah.
30 jobs for one day in one school in Iowa.
And that's, that brings up another issue too, is we do have a teacher shortage in Iowa, and COVID and some of the legislation that they're looking at in schools is certainly going to exacerbate that problem. And healthcare as well. We have a nurse shortage in Iowa. We all saw the news articles recently where we are hiring traveling nurses, out of state nurses, to come in and care for Iowans. And so when we have these dangerous policies being put forth in the legislature, it does impact our workplace, our schools and our hospitals. And in turn, it impacts every single Iowan. It impacts our health, our education, the education of our kids and our safety. So we want to make sure that, our lawmakers are bringing forth legislation that addresses these issues, that not exacerbate it and not make it worse. Yeah, thank you both for those comments. All right. Well, thank you to our speakers, Sue Dinsdale with Iowa Citizen Action Network and Iowa Lower Drug Prices Now, Glenda Guster and Susan Lighthauser, both community activists in Davenport, and Kay Pence, the vice president with the Iowa Alliance for Retired Americans. We're so fortunate to have you all, your expertise, your voices, and you advocating for the hardworking families in Iowa. We know that Iowa can do better. We want to make sure that our state legislators are bringing forth legislation that will better the lives of all Iowa families. We want to thank our host organizations, AFSCME Council 61, APWU Iowa, Healthcare for America Now Iowa, Iowa Alliance, the Interfaith Alliance of Iowa, Iowa Citizen Action Network, Iowa Main Streets and Country Roads, Lower Drug Prices Now Iowa, Progress Iowa, and Tax March Iowa. For those of you who are listening, whether you're listening now on the Zoom call or whether you're listening to Progress Iowa's on YouTube, I would encourage you to follow the happenings at the state legislature. Please be in contact with your local lawmakers. Go to their, their coffees or their forums, or, any opportunity you have to talk to your lawmakers. Email them, call them. Push for policies that Iowans want and Iowans need. Push for policies that make our lives better. We want legislation that looks out for the people of Iowa, not corporate interests. Today, we're voicing our concerns to the governor and to the Republican-led legislature because we know that Iowa can do better and we know that Iowa can be better. We will hold them accountable so that we have a state where all Iowans have a better future. So again, I want to thank you all for being here. Make sure that you follow Progress Iowa on social media, Facebook, Twitter, Instagram, all of those places in social media, and stay up to date on what is happening at the state legislature and how you can be involved and how you can be an advocate for your concerns. So thank you all for speaking today, and thank you to those who are listening.
Thank you.